Proctology, or what is the art and science of treating diseases of the anorectal junction and anorectal region, is a very old branch of general surgery. We've had patients being treated with anorectal diseases for several decades or potentially centuries now, and the treatment options have changed. The reason I've combined anorectal diseases into one video is because they're often treated as one and they're often confused, where they are misunderstood, they're misdiagnosed, and often mistreated as well. Now, the most common anorectal diseases that one has are hemorrhoids, fistulas, and fissures. Now, hemorrhoids, or what is called as piles, often presents with just painless rectal bleeding, which is bright red in color, whereas a fistula in ano presents with a patient that has discharging pus from the anal region, whereas a patient with fissure in ano presents with painful defecation with a small amount of blood that is often seen on wiping. It is very important that we make a distinction between the three, and patients are not treated for anorectal diseases by doctors and other healthcare specialists by just looking at their faces, because it is not possible to do so. Unfortunately, that is what commonly happens. You go to a doctor, you see them, you sat in front of them, and you are being treated for anorectal disease by a doctor who's looking at your face. If you see a coloproctologist who's trained in the art and science of this surgery, they will at the very least perform a digital rectal examination and a camera test of the anal region as well, and we're able to make these diagnoses. I often tend to get an MRI of the pelvis by a specialist fistula radiologist, so that they're able to quantify a fistula for me, and they're able to tell me where the fistula is traveling and how I can treat it best. When it comes to patients with hemorrhoids, we have to make sure that we've done a colonoscopy at the outset, because we should not be missing a cancer that may be causing the rectal bleeding instead. With patients with fissure in ano, they often have a lot of pain and they may not be amenable to a digital rectal examination. All of these patients are treated differently. Majority of patients with proctological problems can be relieved with simple conservative measures that involve no surgical treatment at all. In patients that do need surgical treatment, we have evolved significantly from big operations that left people in pain for weeks, whereas we now are able to do these procedures where we're able to discharge patients home the same day in most cases, if not the very next, and they experience very little pain, if at all. Correct diagnosis is the key, and correct training of healthcare professionals who are delivering proctological care is extremely essential in getting the right treatment for these patients. I offer my patients a variety of approaches that can range from minimally invasive techniques, laser ablations, all the way to open surgery and endoscopic techniques as well. If done correctly, this can lead to a significant improvement in quality of life and years lived in these patients. It is very important to know that other diseases of the GI tract, like Crohn's disease, can present with anorectal disease as well. And we as colorectal surgeons are trained and have the expertise to differentiate the two and deliver the patients the best care that they deserve.